In March 2020, the COVID-19 outbreak was declared a pandemic.
COVID-19 can be characterized as a pandemic.
Since then, there have been more than 400 million recorded cases and nearly 6 million deaths worldwide. Experts say COVID is unlikely to be eradicated, and instead we can expect it to become endemic. So what does that mean? The key difference between a pandemic and an endemic is the speed it spreads. In a pandemic, we see exponential growth across large geographical areas. Disease spreads rapidly from country to country and often across continents. COVID-19, for instance, originated in China and spread around the world. Epidemics also spread rapidly, but within a specific geographical area. Endemic disease spreads more consistently and predictably. For COVID-19 to become endemic, cases would have to be relatively low and constant. But the key point is the virus can't be eliminated. It will be with us for the long term. If COVID-19 does become endemic, cases will be lower, but it doesn't mean that symptoms will be milder. A good example of an endemic but often fatal disease is malaria. Given the recent surge in Omicron cases and the unpredictability of new variants, the transition to an endemic is probably pretty far off. The spread of the virus relies on the ability to infect a high number of susceptible people. The point at which this is no longer possible signals a shift to an endemic, but this is hard to predict. However, with a high percentage of the UK population now vaccinated, it is a positive move in the right direction. If and when COVID-19 becomes endemic, the government will be able to review remaining restrictions aimed at slowing the spread of the disease.
It is my expectation that we will be able to end the last domestic restrictions, including the legal requirement to self-isolate if you test positive, a full month early, Mr. Speaker.
Boris Johnson says he will present a strategy for living with COVID on the 21st of February. As the reliance on immunity increases, we can expect to see a larger focus on global vaccination rates. The WHO originally set a target to vaccinate 40% of every population in the world by the end of 2021. The current target is 70% by mid-2022 as part of their pandemic exit strategy. But the WHO says the world is still a long way off describing COVID as endemic. It is still a pandemic, and the WHO says it's still an acute emergency. And the worry is that a new variant could throw us a curveball, causing severe disease and evading vaccines. That would put us right back.